Welcome to this NR Times live event. And today we're focusing on the future of neuro rehab. I'm really pleased to be able to say our sponsors today are QEF, and we'll hear a little bit more from QEF in just a few minutes. So over the next 2 hours or so, we're going to be speaking to a group of experts who I'm really pleased to say have agreed to share their insight and their experience with us over 4 particular discussions and themes. We'll be focusing on the challenges, but particularly the opportunities facing the neuro rehab community and how we shape the future together to ensure that we continue to develop even better outcomes for that neuro rehab community. But firstly, I'd just like to introduce our sponsors, and we'll hear a few words from QEF now.
QEF's range of expert services enable disabled people to be as independent as possible. Our services can have a life-changing impact which ripples through the lives of the people we support. At QEF's Care and Rehabilitation Centre, we provide expert therapy and care to people who've suffered a stroke, acquired brain injury, spinal injury or neurological illness.
At the Care and Rehabilitation Centre at QEF, we help people to reach their goals, to be more independent and to return home if they can. Rocky came to us after his stroke and he was unable to walk. He needed assistance of one person and equipment for transferring between wheelchair and the chair or the bed.
I'm extremely grateful to QEF. It's an amazing team that gave me the skills and training to walk.
The best thing about my job is for patients to reach their goals, to being independent again and return their home and return to their hobbies, return to their loved ones.
The fact that I'm back home now with my family is amazing. The only way I can describe it is basically, in one sense, you find in life that you almost have to sometimes lose something in life to gain. I couldn't give you any more greater reward than life.
The team at QEF's Care and Rehabilitation Centre in Surrey are delighted to be sponsoring the NR Times Live 2025. There are some very interesting talks lined up this afternoon. My name is Ellie Kearney, lead physiotherapist.
And my name is Mark Jiggins, senior occupational therapist. We are therapists at the QEF Specialist Neuro Rehabilitation Centre, providing intensive and slow stream neuro rehabilitation, complex neurological care and disability management for adults across the south of England.
Our in-house multidisciplinary team support people to regain core skills after acquired brain injury, stroke and spinal injury so that they can be as independent as possible.
We also support long-term neurological conditions to optimise a person's potential, such as multiple sclerosis, Parkinson's disease and Guillain-Barré syndrome.
We provide person-centred therapy and care, and almost 70% of our clients are able to return home with a package of care.
After discharge, our clients also benefit from a free mobility or driving assessment through the QEF Mobility Services, which is a key part of supporting independence. We hope you enjoyed the event this afternoon and find it thought-provoking.
Well, thank you to Ellie and Mark, and thanks once again to QEF. It's great to see their work in action there. So just a little bit about the format today. As I mentioned, we've got 4 separate discussions, but all with that golden thread running through them: the future of neuro rehab and the opportunities for improving care and introducing new approaches and better outcomes. If you've got questions for any of our panelists, put them in the Q&A. And time allowing, each session will be about 20-25 minutes. We'll try and fit in some of those questions. If we don't get to them all, we'll make sure that the panelists and experts that are speaking today we'll get copies of the questions, and we'll do our best to try and make sure that responses from our panelists are up on the NR Times website. So, without further ado, let's move on to our first speaker. I'd like to introduce Miriam Duffy, who's Director of the National Rehab Centre. Welcome, Miriam, and I'm going to ask you, Miriam, to kick things off by maybe just saying a little bit about yourself, your role at the NRC, and your areas of particular focus and interest.
Thank you, Alistair, and afternoon, everybody. It's an absolute privilege to be here. So yes, I'm the director of the National Rehabilitation Centre. I'm a physiotherapist by profession, and I specialised in treating people with predominantly traumatic brain injury, but in that wider context of neuro rehabilitation for very many years. And back in 2012, I was then lucky enough to be involved in the major trauma service setup. So I'm based in the acute hospital in Nottingham, so was involved in setting up that regional service, but also on a national level in terms of the rehabilitation prescription, and was a member of that working group. And it was a real drive at that time to try and increase the profile of rehabilitation, what the service can offer to people, how important it is, which obviously we all understand, but it's not still that level of understanding in the wider population. And that was the start of a long journey from that point to here, because at the same time, there was an overarching programme of work called the Defence and National Rehabilitation Centre programme, which also started. And a big driver for that was the Olympic Games in 2012, and a recognition at that time that we probably didn't have an adequate response to any major incident that happened during that time. So that kickstarted the major trauma process, but that highlighted the really significant capacity gaps that we do have, and we still have, as again, we all understand across the country in neurorehabilitation. So I was just in the right place at the right time, in all honesty, Alistair, to be part of the National Rehabilitation Centre programme of work. That defence piece of work is a legacy from the 6th Duke of Westminster, who was a reservist for 40 years and wanted to leave something significant. And the rehabilitation campus that was chosen is in the East Midlands, obviously where I'm based. And the two centres, the Defence Centre and the National Centre for NHS patients, are co-located within 400 metres of each other, but situated on a purpose-built rehabilitation campus, which is in 300 acres of very beautiful parkland. So that was very lucky for me, and I have directed that programme of work ever since. In terms of where we are with the NRC and the priorities around that, first and foremost, it's about transformation and driving those high standards of rehabilitation across the country, learning around best practice from other places in the world. And we've done a lot of benchmarking and a lot of research around that. Sadly, mostly during COVID, so we weren't actually able to get on a plane and go out and about, but nevertheless, we spoke to a huge number of people. And understanding that actually when people enter rehabilitation in this country, they get a great service, but there's a huge number of people who don't ever access a rehabilitation bed. So we're looking at the very acute phase of rehabilitation, people coming straight out of acute beds. We're not at the moment influencing community services, although we are hoping to get people into better outcomes for entering into those community services. And everywhere you look at this, it makes sense, doesn't it? So the economic value to rehabilitation is enormous, and we're building a building, so we've had to go through a capital business case process with the government, and economics is very important in that, and it's very important to demonstrate it anyway. But the average cost of a rehab spell in this country is £39,000, which is pretty good value for money, I would say. And that saves over £500,000 on every person's lifetime on ongoing health and social care costs that they then won't need So that's investment that I think is very important to make. And through the NRC, we are providing a service which takes people very early in their recovery journey. So we have put a very strong medical model around that patient so that we can focus on rehabilitation very early, but in a very safe way. We're not situated on an acute campus, so that's given more impetus into that medical presence. But it also helps to drive the understanding in the medical specialties around rehabilitation, the importance of that. And we've done a lot of work in that way in terms of education. And we are also really thinking about how we can provide a very intensive and very varied day on that campus, given that we have got fantastic facilities. And I should say that the Defence Centre that is situated just next door has good facilities that we are able to physically share, but the idea is that we share those expertise across those two campuses as well. And for the first time ever in rehabilitation, bringing those two services together. We're very technology enabled in the new building as well, and it's a real opportunity, isn't it, when you build a new premises to be able to digitally enable as much as possible. So we will be the first net zero carbon NHS operational building. We will have some robotics in there and neurophysiology, and really want to encourage people to come and be innovative, to develop new products with us. We have academic partners, and we're already developing some international collaborations around the field of rehabilitation. So the NRC is in three parts. It's the National Hub for a New Clinical Model for Rehabilitation, it's the National Hub for Research and Innovation, and it's the National Training and Education Centre, all around the for NHS. So I'm happy to stop there, Alistair, and take any questions that might have come through around NRC and what we're trying to do.
That's great, Miriam. Thank you for that. And I think you've been very modest about being in the right place at the right time. But a couple of questions that I've seen come in there. You talked a little bit about innovation and academic and industry partnerships. Could you say a little bit more about new pathways and models being developed and the role that innovation and new approaches plays in the NRC?
Yeah, no, absolutely. So I think when any of us talk to partners and potential partners in industry, they find it very difficult to break into the NHS in many respects in terms of the regulatory framework around that, and it's almost too much of a barrier even to get started. So we hope to be an enabler in that respect, to work alongside people from industry and companies who are interested in developing a new product or a new piece of technology, maybe a new application, to facilitate the process of rehabilitation. And we have space dedicated in the NRC building to do exactly that. And we will offer the opportunity to work with our clinical staff, to work alongside patients where appropriate, and also with our academic colleagues in order to research, to try and test those products out. And really the aim of that is to develop products which are suitable right from the inception, and to try and minimize that embryonic development stage and people going down the wrong path, but also to speed up that whole cycle to try and get new products out into the market, which would be of benefit to that wider population.
And I assume that research is going to play quite a key part in that in terms of your academic partnerships, if not your industry partnerships.
Indeed. So research is a big driver for us and a really important part of where we are hoping to make a significant impact. So there are really good pieces of research going on, both in the UK and around the world. We are embarking on a programme of work to involve those partners, both nationally and internationally, and develop an enabling framework and some flagship research programmes over the next 2 to 5 years, really focusing on where we see those gaps and identifying where research could have the most significant impact. And at the moment, I see that all around the field of technology. Actually, there's new technologies emerging all the time, which are incredibly exciting, not only as an adjunct to what a therapist can achieve, but also enabling people to be much more independent when they leave a rehabilitation setting, go home, so that they almost become part of their daily lives. And if we can integrate those technologies as much as possible within the rehabilitation process, then so much the better. They're more likely to be adopted. So research around all of that is increasingly important. Research around the economics of this is also really important. So, joining up areas of work and focus around what is the impact of getting somebody back to work, for example? What is the impact of enabling that person to become part of their previous social activities around their community, part of their uh, purpose and desire for life again? How does that impact positively, not only on them and their family, but also economically, because that will be a huge determinant of how we can invest further in rehabilitation.
Yeah, it's interesting when you talk about the economic impact as well as the social and the personal impact as well, Miriam. I guess as legislators look at this, and those involved with legislation, you have to ask about education and awareness. And is that part of your role as well, to raise the profile of neuro rehab and to convince those people that will be responsible ultimately for the kind of investment that some of the things you describe need, to educate them and wider communities about the importance of neuro rehab and the impact of some of these new approaches?
Absolutely. And we feel a huge amount of responsibility for that. And I think everybody on the panel today would also be wanting to raise the profile of the impact of neurorehabilitation. It is a really cost-effective service at the end of the day, and so very important, as you say, not only for that individual, but also for their family, their carers, their supporters. It will enable that wider group of people to get back to previous activity and in some cases not have to give up work to care for a loved one. And it's in terms of government investment, there's a lot of competing priorities, even within the healthcare space, isn't there? And the more understanding we have economically of how we are positively impacting, because this is a positive impact story, it's not a drain on resources at all, then the more likely people are to start understanding that. And of course, the time is right, isn't it, with the drive and agendas around returning people to work? How can we impact on that? Where I don't think we really understand at the moment how much we can positively impact people back into that workplace, because the offer is fairly minimal at the moment.
And just maybe as we move towards talking about widening access and how you reach out to new patients and new groups, is education and awareness a wider issue amongst some of those affected in the neuro rehab communities, their families, their friends? Is that something that the NRC can contribute to in that dialogue?
Yes, no, absolutely. So we're already in touch with a lot of charities around that and how we can support that education piece, how we can develop awareness and supported conversations. So one of our big pieces of work at the moment is looking at how we support families and carers to have constructive conversations with their family member who's been through and going through a rehabilitation process for whatever reason, and how we help them understand any red flags that might be linked into that conversation, how we then enable them to signpost people or to come back to us. But that wider piece of education is so important, isn't it? Because my feeling is largely, unless you've had personal experience of rehabilitation or you're working in the field, people are generally pretty unaware of what we do and the positive impact that rehabilitation can have and does have every day in people's lives. So when people are making decisions around investment and other things, it's really important that they understand that.
Obviously, you're working with the NHS, with private sector groups, and a range of groups from other sectors potentially. As I've been speaking to people in the neuro rehab community, this issue of having to have an integrated care plan and service keeps coming up. Do you have a role in providing an effective bridge to continue to improve integration between private and public sector services for the neuro rehab community, Miriam?
I think everybody does. I think, increasingly we can't work in isolation and we shouldn't work in isolation. People will draw on a number of different services to enable their lifestyle and recovery. And I think it's really important that we learn from each other, we talk to each other, we're aware of what work is going on and um, the ability to maximize the opportunity around that person by doing that rather than working in isolation. So yes, and the rehabilitation at this early stage that we're involved in will hopefully have a positive ripple effect out to all of those other providers around more community services. And we can't not have that conversation, I think.
It seems from what you've said that the NRC is having and will continue to have a transformational impact. It'd be interesting to hear you talk about maybe your hopes for the future and the hopes that people in the neuro rehab community that come into contact with the NRC might have for the future. Can you talk a little bit about how you see the future developing and what kind of expectations and optimism should people have based on the work that you're doing?
Yep, of course. I mean, my hope for the future is a very simple one, that everybody who needs rehabilitation has access to rehabilitation, and we know that we're a long way from that at the moment. The WHO figures in their 2030 campaign suggest that only 40% of people have access to rehabilitation across Europe who needs it. And I think it's the same in this country. So by enabling people to access services early and by enabling people to understand the need for those services, then I'm hoping that, and the onus really on us is to demonstrate that this new way of working works, and then we can expand that out across other regions in the country so that access is easier for people.
I've got a couple of questions for people watching, if that's okay, Miriam. A short one firstly, just a couple. Which patients will have access to your facilities? Just those that are in the local area? Question mark.
The National Rehab Centre is the national hub for the new clinical model. So that's based in the East Midlands. And whilst people can access the service from anywhere in the country, this is really the driver for a regional model, understanding that people do need to be close to home to access rehabilitation. And once we've proved the concept of doing things differently, the ambition then is to roll that new model out across the rest of the country. But just as people can, at the moment, people can be referred in from anywhere.
Great, thanks for that. And maybe one final question from those watching. Will the centre be adopting best practice on user-centred design for new and existing technology involving people with neuro rehab needs from the outset of the R&D process? That would be great to see.
Yes, short answer, yes, because we've already done the design of the building. That's been happening over the last few years. And yes, people have been involved from all different areas, so patients included. And we've had some great ideas that have come through in that route. In terms of designing R&D, people will be consented to be part of a research study when they come to the NRC. And we're developing a new data set for rehabilitation at the NRC so that we're hoping to get some better data around what we're doing and the impact. And we have a very strong PPIE group who are helping us in the work to design that research programme of work that I was talking about earlier.
Fantastic. Miriam, thank you very much for joining us.
It's a pleasure.
You've created time in a very busy day to respond to our questions and to give us some insight into the NRC. I think all of us will be inspired by some of the work that you're doing and the expectations of the work to come in the future. I hope if we can send you any other questions that come in, and there's a few more just coming in as I speak, then maybe you'll have the chance to respond to those and we'll put them up on the NR Times site. So on behalf of NR Times and their sponsors QEF, can I just say a big thank you, Miriam, for joining us?
Thank you very much for having me.
Thank you.
It's been a pleasure. Thank you.